Hello everybody, and welcome to this webinar on prioritization questions. So I know we're not quite at 1 p.m. Central yet. We have a couple more minutes, so I'm going to give everybody a second to get logged in. So before we get started, I'm just curious, is anybody scheduled to take NCLEX in the coming weeks or days even? By the way, I want to start by saying there is a delay in seeing chat messages. So whenever you type, it does take a couple seconds before I can see the answer. So sometimes there's some awkward pauses and I'm not ignoring you. December 8th. Jalen, well, I have no doubt this prioritization webinar will help you today. November 14th. Okay, very, very soon. Good luck. Second attempt, okay. Ariana, well, I guarantee you will see some prioritization questions on the exam. So somebody asked how long the webinar is today. It's going to be about 30 minutes. Tomorrow, Joni, good luck. Okay, so we have a lot of people getting ready to take it very, very soon. A couple people going in for their second attempt. So best of luck to you. I have no doubt this information is going to help. So let's go ahead and get started. So I'm Dr. Amber. I'm one of the nurse educators here at bootcamp.com. And we do have a moderator that you see in the chat. That's Miss Miriam. She's also a nurse educator here. She'll be answering any questions that you have and also sharing some information throughout this presentation. So once again, today we're going to talk all about prioritization, which I know can be a very challenging subject and very intimidating for most people. So let's go ahead and get started. So we're going to talk about some general principles of prioritization, and we're also going to talk a lot about how we should be approaching these prioritization items strategically. The types of things we should be thinking about when we see a prioritization question pop up so that we can feel confident and kind of know how to navigate them versus just simply being overwhelmed with the vast amount of information you sometimes get in these items. So before I get started, I want to remind everybody to follow us on our socials. And if you have Facebook, we do have a very active, wonderful study group on there. Please join and invite your friends. I also want to remind you guys that we have been working very hard at bootcamp.com on some amazing cheat sheets. If you haven't heard about them, they've been making quite the splash. We've got a lot of really great feedback from students that have taken the NCLEX. So please check out our cheat sheets, and we do have one devoted specifically to prioritization that's going to cover some additional information that we really don't have time to cover today with our practice questions. So please check that out. Okay, so why are we talking about prioritization? Well, one of the most important reasons is I guarantee you will see prioritization items on NCLEX. So the NCSBN that creates the NCLEX, they're very transparent about what's on the exam. And so when we look over here in this right-hand corner at the NCLEX test plan, we can see that management of care items count for almost 20% of the exam. So that's quite a large number of what you're going to see on the exam. And these management of care items include prioritization, delegation, and assignment making, which I know can all be pretty challenging topics. But today, once again, hopefully we'll break it down so it feels a whole lot easier by the end of this webinar. So one of the reasons that you will see these items so frequently on the NCLEX, it is one of the best ways to assess critical thinking. So we've all heard everyone say NCLEX is a safety exam, and it absolutely is. And one of the best ways they can assess if you're a safe nurse is determining if you are able to figure out what patient do I need to go see first, or what task do I need to perform first. So it's a wonderful way to assess critical thinking. Now, the reason that prioritization can kind of be challenging is because it does require us to kind of take a step back and look at the overall clinical picture of the client. And we also have to be able to kind of imagine or predict the progression of their disease process. And that can be really challenging when you're a nursing student or a new graduate nurse and you haven't had a lot of clinical experience. So I know these can be a little difficult, but once again, we're going to make them easier. And then I want to remind everybody that prioritization questions can be formatted many different ways. So what I did today is I made sure that I brought 3 practice questions that we can go through together that are all formatted a little bit differently so you can get a variety of experience in how you might see these items asked. And then also, I just want to remind everybody that prioritization doesn't stop after NCLEX. It is a primary nursing skill that you need to continue to work on practicing and developing so that you can be a safe nurse. So before we jump into the practice questions, I wanted to show y'all one really helpful resource that we're going to use throughout the webinar. So this is our NCLEX Bootcamp Prioritization Pyramid that we worked really hard on to try to give you guys a resource or a tool so that when you are sitting there trying to figure out a prioritization item, you can look at this pyramid and it kind of helps you have a strategic approach to help guide you as you navigate these questions. So we've all heard probably people say, oh, prioritization, just focus on ABCs, that kind of thing. And although that information is helpful, that really doesn't look at the overall picture and it's not very comprehensive. So that's where this prioritization pyramid came in. So let's briefly talk about how do we use it, and then we will practice with it on a couple of questions. So the first thing we're going to do whenever we see a prioritization item is we're going to start with step 1 over here on the left, and we're going to eliminate any stable or chronic issues. So let me give you an example of that. A stable issue would be a client that, for example, has a fracture. Maybe they have a fractured wrist and they have some mild pain and swelling at that site. Is that stable? Do we think that that's expected and normal for this client? Yeah, there's nothing to indicate that that client's not stable. Now, if it said that you have a client with a wrist fracture that has no pulses distal to the injury, or they have decreased sensation or tingling, that would all be concerning findings that our client might be unstable and experiencing a perfusion issue. But in this case, the client's stable. So they would not typically be a high priority, and we can eliminate them as a high priority before we look at anything else. Another thing that we can typically eliminate right at the beginning is chronic issues. And an example of a chronic issue would be, for example, a client with advanced COPD. Can someone tell me what do we expect the normal pulse oximetry range to be for a client with advanced COPD? What do you guys think? Do we expect it to be normal, above 94%, like it is in most clients? Probably not. So it's typically going to be about 88 to 92%. So if we're looking at a prioritization item and it says that we have a client with COPD with a pulse oximetry of 90%, we can expect that. It's a chronic issue and that's normal probably for that client. So once again, these guys are typically not our highest priority. So we can eliminate them, and then we move on to step 2, which is actually looking at that pyramid. So the bottom in bright red to get your attention are the issues that require immediate intervention typically. And those are going to be airway and safety issues. So any type of acute airway or safety issue is usually our highest priority that needs immediate intervention. And then it is followed by breathing, circulation, and disability. Disability is just another way to say neurological, so altered mental status, stroke, that type of thing. So we can do our A, B, C, Ds, and once again, safety and airway are both very high priorities. And then our lowest priorities are at the top of the pyramid. And that's going to be our routine tasks, our expected findings, and then psychosocial needs. And what I mean by psychosocial needs is just anxiety or frustration. Although those things are, not ideal, they typically are not going to kill us. And that really, guys, is the fundamental principle to follow when we're looking at prioritization, is we have to ask ourselves, if we don't perform this task or if we don't see this client, who's going to die first? Like, what life-threatening condition do we see? Because that's always going to be our highest priority. Okay, so I know that was a lot of information. So let's actually look at a couple of a couple of items and look at our prioritization pyramid as we go along. So this first item is formatted in probably the most traditional, most common way you will see a prioritization item formatted. And that's where we are having to identify the sickest or the most acute patient that we need to see first. So we always want to read our stem very closely. So it says the nurse should first assess the client who is obtunded on hospice care and is becoming restless, a client who had a cholecystectomy 2 hours ago and is reporting nausea, a client that has a peptic ulcer with a rigid abdomen reporting sharp abdominal pain, and our last client who had abdominal surgery 2 days prior and reports left lower extremity pain and swelling. So let's take a closer look at these options and look at our pyramid and see if we can figure this out. So first option is obtunded. Do we remember what that means? Obtunded is kind of lethargic. They're on hospice care and they are becoming restless. So this is where I'm going to go ahead and give y'all a really helpful test-taking tip for NCLEX. And that is, be very careful to not just latch on to a single word or finding and just run with it. And that is, a lot of times we worry whenever we see that a client's got a change in their mental status, because that can indicate a lot of life-threatening issues, such as stroke or hypoxia. But for this client, we have to look at the context, okay? And that's with any item, especially prioritization. We always have to be very careful to look at the full picture. This client is on hospice care. So do you guys think if we have a client that's on hospice care, which means they have a terminal illness, and they're lethargic and there's a change in their mental status, do we think that is expected for a client that is on hospice care with the terminal illness? Especially as they get closer to the dying process. Do we expect a change in mental status and some lethargy or obtunded? So I'm already seeing that you guys have some wonderful guesses on the right answer. So I love the engagement. It makes it a lot more fun for me. But remember, there's a lot of learning in the wrong answers too. So we'll see if y'all are right. So I'm seeing a lot of people say that that's expected. That's correct. So once again, when we look over here at our pyramid, that's an expected finding. So that's not a high priority. So let's look at option 2. We have a client with a cholecystectomy 2 hours ago reporting nausea. So remember, cholecystectomy is a gallbladder removal. And we just had this surgery about 2 hours ago and they're having some nausea. So do we think this is an expected finding? So let's talk about this. Anytime we have a client going to a surgery, typically they get anesthesia. And we know that one of the most common side effects of anesthesia is nausea. And then also we have a client that had a gallbladder issue, obviously, to warrant the surgery. And so just gallbladder issues alone can cause some nausea and vomiting. So for this client, that's also a pretty expected finding. So we'll put that also up there at the top. So you guys are loving option 3, okay? And I see a couple people I've already identified the diagnosis, so I'm very impressed. So we have this client with a peptic ulcer. They have a rigid abdomen and sharp abdominal pain. So do we think this is an expected finding for a client with a peptic ulcer? What do we think? So typically with a peptic ulcer, you can have some abdominal pain, but I'll tell you what's really concerning for me is this right here, rigid abdomen. So this is another helpful NCLEX tip. If you ever see the word rigid abdomen or board-like abdomen, that's a big old red flag that we have a life-threatening condition called peritonitis, which you guys have already identified, so kudos to you guys. So peritonitis, remember, is inflammation of that peritoneal cavity in the abdomen, and if left untreated, it absolutely can cause life-threatening complications. A lot of times we see shock, so we see tachycardia, we'll see hypotension, and it is certainly a life-threatening issue related to perfusion or circulation. So when we look over here at our pyramid, it's a circulatory issue. So far, I agree with you guys. I love 3, but let's take a look at 4 just to be safe. So option 4, abdominal surgery, abdominal surgery 2 days prior, left lower extremity pain and swelling. So anytime we have a client that had a recent surgery, typically they're not as mobile as they normally are. So you have some immobility. So anytime we have a client that's immobile, what are they at risk for? What do we think? Sitting in that bed, not really moving around. What is a really big risk factor? They're at risk for, I can't talk today, guys. DVT. Y'all got it. So with DVT, you will experience that unilateral pain and swelling. Now, this is where it gets kind of tricky because that is also a circulatory issue. So you might say, well, they're both circulatory issues, so which one is the higher priority? Well, we once again have to look at the context. So with the DVT, it is still just localized to that lower extremity, okay? We are not seeing any indication that it is a systemic problem at all. Whereas with option 3, with peritonitis, they are at risk for shock. So they're at risk for systemic circulatory issues, which is going to be a lot more life-threatening quicker. But let me tell you about when option 4 could potentially be correct. Let's say we have the same situation where we have a client with lower extremity pain and swelling who then suddenly reports a feeling of impending doom with difficulty breathing, with chest pain. What do we think's going on there? If we have a DVT and suddenly we have a feeling of impending doom, difficulty breathing, chest pain. PE, very good. So we're at risk for pulmonary embolism. So if that was the case, that's either a circulatory or a breathing issue. And so that would be a higher priority than option 3. But that's going to lead us to another really, really important testing point, is that we don't ever add information. Now, one of my favorite pastimes when I was a nursing student is going down a rabbit hole when I would read answer choices. And I know some of y'all might struggle with that as well. But remember, the NCLEX is not trying to trick you, neither are we, so always take it for face value. If it just says left lower extremity pain and swelling, let's just believe them. Let's not start thinking about how it can turn into a PE and that's technically a breathing issue. Don't do that to yourself. It's a good way to set yourself up for failure. So I think we got it correct, and we did. So kudos to all of you guys. Y'all are doing awesome so far. So let's look at our second practice item. And this is another really common way that you're going to see prioritization items formatted, where we're still trying to find the highest priority, but instead of looking at the client, we're going to look at the client need or the task. So let's take a look. The nurse has been made aware of the following client situations. Which of the following client needs should receive the highest priority? So it's basically asking us, which task should we perform first? So let's look at our options. Administer an antibiotic to a client with cellulitis that was due 1 hour ago. Assess the client who reports redness and pain at an appendectomy incision site. Assign assistive personnel to stay with the client who is reporting suicidal ideations with the plan. And provide discharge education to a frustrated client who has been requesting paperwork for 2 hours. So let's take a little bit closer look, because all of these things we need to do, right? So administering an antibiotic to a client with cellulitis that was due 1 hour ago. So that right there is a routine task that does not pose any type of life-threatening risk to our client if we delay it at all. Now, if we delay that antibiotic for, days, certainly they'd be at risk for some issues such as sepsis, that type of thing. But it's just 1 hour. This patient is most likely not going to have any type of life-threatening complication if we don't administer it right now. So far, that's not looking like the best task. Option 2, assess the client who reports redness and pain at their appendectomy incision site. So whenever we have a surgical incision with redness and pain, what does that potentially indicate? It can indicate really a couple things. Sometimes just the trauma of surgery will cause some redness and pain, but it also can indicate infection. And so this is not necessarily an expected finding, but it is stable, okay? Right now, all it's saying is that there's some redness and pain. And we want to assess it, but it's not looking like the most important thing. And then you guys love option 3, and I agree with y'all. So assign assistive personnel to stay with the client reporting suicidal ideations with a plan. So we all know it's already concerning when your client is reporting suicidal ideations, but when they report they have a plan, they've typically thought about this, and there's a much higher likelihood that they'll make an attempt on their life. So that is a huge safety issue. So I think you guys are right, but let's take a quick peek at option 4. So provide discharge education to a frustrated client who's been requesting discharge paperwork for 2 hours. So I would also be frustrated if I was them and I'd been asking for paperwork for 2 hours, but ultimately that is a psychosocial need up here, which is a low priority. Now, certainly we want to use therapeutic communication, we want to address that need, but it's not posing any type of life-threatening risk. So I love option 3, and so do you guys. And so we got it correct. So y'all are doing amazing, by the way. I'm super, super impressed. Let's look at one final way that prioritization questions are formatted. And you don't see this type of formatting as often, but there's a chance you can see these. So I wanted to go ahead and throw it in so you're not shocked if you see something like this on the exam. So it says the nurse is caring for admitted clients involved in a mass casualty incident. The nurse must discharge a client to make a bed available for more injured clients. It would be most appropriate for the nurse to recommend discharging which client. So if we are planning on sending somebody home, we need to find the client that is least sick, or basically the lowest priority. So we're kind of working backwards. So our options are a contusion to the chest wall with a heart rate of 110, soot around the nose and mouth and a respiratory rate of 30, a headache and bruising behind the ear following a head injury, and superficial non-bleeding abrasions to the face and upper extremities. So let's take a closer look. So I see already a lot of people are making some guesses, but pay close attention, even if you think you know the right answer with this one. I chose this question for a reason. There is a lot of super high yield conditions we're about to talk about that you want to be able to recognize whenever you go to take the exam. So the first one, you have a contusion or bruising to the chest wall with a heart rate of 110. So we know that heart rate's a little bit elevated, so they are a little tachycardic and there's bruising. So what do you guys think? If y'all are working in the emergency room and you have a client that comes in with bruising to the chest wall and they're a little bit tachycardic, what are you worried about? Any specific condition come to mind? What do we think? And once again, like I said earlier, there is a slight delay in me being able to read y'all's comments. So I'm worried about cardiac tamponade. Okay, so if y'all remember that, there's that pericardial sac around the heart and it can fill up with fluid. And that heart can't pump as efficiently and you start seeing decreased cardiac output. So you're going to start seeing changes in the blood pressure. You're going to start seeing tachycardia. So the point to all that is, do we think that if a client has bruising of the chest wall and tachycardia, they are stable to go home? No. So that's going to be probably like a circulatory issue. And Irene, also you said pneumothorax, and that's, it could also be pneumothorax anytime you have chest trauma. And so even still, that's a breathing issue. So either way, I don't want to send them home. And then option 2, this one I want you to pay close attention to these keywords. Soot around the nose and mouth, and respiratory rate of 30, which we know is a little elevated, so they're a little tachypnic. But anytime you see soot around the nose or mouth, or someone is coughing up sputum and there is soot in there, that means that they have breathed in smoke. So we are concerned about an inhalation injury. Now this is very life-threatening. Okay, a lot of times in the ER, which is where I worked for most of my nursing career, if somebody has an inhalation injury and they have any type of symptoms such as this increased respiratory rate, we go ahead and intubate them. the reason this is so dangerous is smoke is an irritant to the airway. And so as the airway gets irritated, it gets more and more inflamed. And before you know it, that patient can't breathe, but we also can't really stick an endotracheal tube down there because of all the swelling. So anytime you see soot around the nose or mouth or in the sputum, that is an indicator of a life-threatening condition and very high priority. So once again, it's airway or breathing. We are not sending them home. And then a headache and bruising behind the ear following a head injury. So any bruising behind the ear, okay, that has a name, battle sign, okay? Does anybody remember what injury that is usually associated with? If we see battle sign or bruising behind the ear, is there a specific injury we need to be worried about? Another thing you could see on the exam. It's going to be a basilar skull fracture, and that's also a life-threatening condition that can cause changes in intracranial pressure, that type of thing. So it could be a circulatory or a neurologic issue. Either way, they're all pretty high priorities on this pyramid. We don't want to send them home. And then y'all, I know y'all loved for, and so we have superficial non-bleeding, keyword non-bleeding, abrasions to the face and upper extremity. So that is a stable client, and that person, I would feel safe sending them home. So we got it correct again. Okay, so once again, we certainly want you to approach these prioritization items very strategically, because once again, it usually typically involves many different disease processes, many different tasks. So you're having to use a lot of your comprehensive knowledge in order to have a really good overall picture of the different options. So please continue to practice, use our prioritization pyramid, check out our cheat sheet. And I'm going to give everybody a second to ask any questions they may have. And while y'all are putting some questions in there, if you have any, I want to remind you guys to follow us on our socials. I know Miss Miriam has probably already shared those links. And I also wanted to just briefly show y'all our website. So if you go to bootcamp.com/NCLEX, you will see right away you can start studying for free, and we have some amazing resources. We have some really well-developed case studies, our cheat sheets, practice questions, and we've had a ton of really positive student feedback that it very, very closely mirrors the NCLEX. So by all means, please take a look and see what resources are available on that website. So let's see if we have any questions. Any questions, guys? Well, I just want to thank you all so much for joining us today. Once again, I know prioritization can be a challenging topic, and so I hope this helped you guys. Jennifer, well, thank you for joining us. I'm glad you're enjoying it. Okay, any questions? Okay, guys. Well, I hope you guys have a wonderful rest of your day, and please join us next week for our scheduled webinar then. Bye.